Wonderful. So thank you, everyone. We are Zekteck. We are an information security and compliance partner for small healthcare providers. Now, my whole life, I went to small medical practices. For those of you in Reno, probably the same doctors and dentists because they've been there forever. And I never went to a hospital or a major health system for any of my care. It was always private practice. And then when I got into consulting, I found that I would work with these large health systems and they would pay millions of dollars a year for information security and HIPAA compliance. And I couldn't help but think, what are these small guys doing? What are these private practice dentists doing? What are these private practice orthodontists doing? And what I came to find out is that they really aren't doing anything. Most of them think they're HIPAA compliant and they're really not. And some of the reasons for this is because information security and compliance services just aren't accessible to small healthcare providers. They're too expensive, and so security becomes an afterthought for them. So Chris, if you want to talk about the solution a little bit.
Sure. So our solution to the problem is really twofold. The first is a portal, a client portal that the practice can utilize. It's centralized and secure, where we can keep all of their documentation. It allows for them to manage their employees, their vendors, as well as tasks. So through the portal, there can be security tasks that are gamified that they can complete as needed and assign to their employees with a real-time dashboard. So they get an immediate view of how they're doing on their security components. So as you can see here, this is our beta version of the platform. The charts have changed a little bit, but it gives a really clear and colorful illustration of how they are doing on multiple security components. And then through the top there, you'll see their central secure document repository. Through the service, if they choose a plan that provides it, we will take their existing documentation and redo it or create it to make sure it's HIPAA compliant. We have reference information that is specific to that practice. So at any one time, they can pull up the reference information if they were to get audited or if they just needed to know something more. On the business management, they're able to track training for their associates. They're able to track their tasks and see what's overdue. They're able to create and manage vendors, so check in, check out with logs. They're able to add employee roles that are then tracked by application. So at any one point, they can pull up a report that shows what access has been given to which employee. And then on the end there is the support tab. So with certain of our subscriptions, they will have 24/7 support available to them. And that's done through both live chat on the website, as well as a support ticketing system there. And this is fully secure and it's company based. So based on how the owner sets up the portal, the owner will have access to all information and they can then dole that out to their employees as needed. Go ahead,
Thank you, Chris. So, thank you. I'll talk a little bit about our target market. All of healthcare information security is about a $10 billion market. Like I said, some of these health systems are spending billions of dollars or millions of dollars a year, sorry. The attainable market, which is about a $6 billion market, are private practices. So private practice physicians represent about 55% of all physicians in the country. So that's where that is sort of coming from. Our target is small healthcare providers, which is less than 30 users, which is about, it's that $6 billion. Our obtainable market, we feel in the next 5 years, is around $4.5 million in revenue. Some of the reasons for going for that sort of obtainable market is we really want to truly be a partner. As I said at the beginning, we don't want to just be a app that someone downloads. We want to be there with them. So there's some services, especially on the earlier end of this platform, that have to happen in order to build that relationship. We have moved towards some scalability from the platform perspective, but from a services perspective, we'd still really like to maintain relationships with our clients rather than just be a phone number that they call when something is not working. So we do have some competitors in the market right now. The majority of them are compliance only. They don't really focus on the IT or security side of things. So the white lines represent all of the offerings that we have that we share with some of our competitors. So you can see they'll do a security assessment. Per HIPAA regulation, every year they have to fill out what's called an SRA, a security risk assessment. And most of our competitors will go through that with their clients. What they don't do is automate it, which is one of the purposes of our platform. We can automate the security risk assessment for them every year. You can see we create the HIPAA documents, and most of our competitors have some sort of storage platform for the documents where they can access it. Our platform does that as well. We do create and store their documents with them. But our platform, like Chris mentioned, goes into the IT realm of access management, application management, software security, support services, references for troubleshooting or trying to see if an email is a phishing scam or not. And then we do offer training, which most of our competitors offer. We are doing in-person, and then we're also working on developing online training that people can either buy a la carte, or it'll come with the subscription and be a part of the portal. And then we offer some level of incident response dependent upon the subscription level. So our pricing comparison with our competitors, we price right around plus or minus 13% of our competitors. Monthly, you can see we're right in around that $200 a month mark, or annually, you're looking at around $2,000 as well. This is our business model and our pricing model. So as you can see, we have two subscriptions. Our basic subscription is mostly just the platform with some assistance. Our advanced subscription is the platform, and then you also get all of our information security services as well. So this will be like helping implement password management tools. We go through all of your network devices and make sure they're secure, just sort of those activities. And then the pricing is divided by the size of the business. As you can see, 1 to 10 users, 11 to 20, and then 20 to 30. So that way we can make sure that we're scaling appropriately to the size of the business. These are some of our financial projections for the next 5 years. As you can see, there's that $4.5 million in revenue. We are planning on having around $150,000 in revenue for the first year, which includes some revenue that we've already earned. And if you look at the profit table, you can see that we do plan on being profitable throughout our existence. Before I go into the ask, I'll give you a little more background about myself, and then I'll let Chris give a little background about himself. As I sort of mentioned, I've been in information security for about 6 years, consulting with one of the larger information security firms and some smaller ones. I did go to the University of Nevada, Reno with an information systems degree, and then I recently graduated from Northwestern with a master's in information security.
And I am Chris Osterhout, and I have 10 years in business operations and 6+ years in both IT as well as systems administration. And I also have a bachelor's of science in information systems from UNR, and that's where Lewis and I met.
Yep, good time. So what is the ask? The ask is $275,000. The majority of that is going to go into salaries for Chris and I. Hire one more security analyst is what we're calling them, and their purposes are going to be essentially handling those beginning setup tasks for the portal, doing an assessment with the client, most of which is for the most part automated through the portal, but we have to do like walkthroughs and so forth because there are some physical security requirements for HIPAA. So just having someone who understands security enough to sort of assist the client and then also help handle support calls. And then a couple of salespeople for outbound marketing. The majority of these physicians or healthcare providers, they're pretty busy and they really actually enjoy when someone comes into the office and talks to them, or even the office managers as well. They like that face-to-face or even the phone calls. So we'd like to hire a couple salespeople to handle that. And then we want to put 20,000 of that money into marketing. We do believe that inbound marketing is going to be a really big part of our acquisition. So we wanted to make sure that we are allocating something for that. And then our working capital is about 10,000. And that's it. So thank you very much for your time, everyone. And our contacts are down there if you want to contact us separately, and we'll take any questions now.